This is a 38-year-old female who came presenting with pain in the left heel for now 8 months that has been progressively increasing in intensity, worsening usually in the morning as she wakes up from her bed to stand and walk. So abadde n'obulumi emyezi 8 emabega paka olwaleero. So obulumi buno nga buli mu kasinziiro naye nga bumuluma okusinga ddala bw'abanga azukka ku makya okusimba ebigere atooka atambule. So buli waba azukka bw'ati okusimba ebigere ng'obulumi obwo buba bw'amaanyi, naye bw'atambulako akaseera akatonotono obulumi obwo ne bugenda nga bukendeera naye buddamu singa aba awummudde n'agezaako okuddamu okutambula. So that has been the pattern. So at first it could respond to painkillers during the early stages, but of recent the response to these painkillers has been less. And that's why today we are going to look at plantar fasciitis, which is the inflammation of that fibrous tissue that maintains our arches in our feet, including the risk factors and how we can manage and prevent it. So the foot is made of different bones. Those are the tarsal bones, the metatarsal bones, and the phalanges. So it is through these bones that the weight you exert on the leg through the foot reaches the ground. And there is a certain arrangement of how these tarsal bones are arranged to make that arch so that the weight you put on this foot can either directly reach the ground or indirectly distributed through the arches to reach the ground through those other bones. So we have different types of arches within our feet, and also we need to know that one of those structures that have to maintain these arches is the plantar fascia, which has to link the hind foot or the hind foot bone, which is the calcaneus majorly, to the forefoot bones. So when that plantar fascia inflames, it is what we call plantar fasciitis. So plantar fasciitis can be secondary to either overuse of that fascia, as you stretch it or as you apply weight inappropriate on it, or when there is a piercing structure into it directly, and which is the case with this lady. So, and this piercing structure is the outgrowth from the bone which makes up the heel, which is the calcaneus. So how does it come about? So remember, from our senior 2, action and reaction forces are equal but opposite. That is Newton's third law of motion. So when you exert this weight on the foot, there is always that reaction force that you get from the ground, which is directly opposite and equal in magnitude to the weight that you exert. So we usually have the padding of our feet, the sole of the foot that you are putting on, that has to act as a shock absorber between those two structures. That's the hard bone and the ground. So this weight you are going to exert it today, tomorrow, and repeatedly. As time goes by, time will reach when the magnitude of this force is directly felt by your bone, and this will trigger an inflammatory reaction at your bone site. So you'll have a repetitive inflammatory site that will where minerals will deposit, and then these minerals that are deposited will calcify and come up with an outgrowth. So when this outgrowth comes, it will have no problem with you so long as you're not bearing weight on the foot. That's why whenever you're resting, you have no pain. But on putting the foot down to exert weight, this outgrowth will directly pierce the plantar fascia, and you will get the pain because you are having a piercing structure within the plantar fascia, stimulating the inflammatory response for you to stimulate your nerve endings, and you get pain. So that's why that pain usually comes in intervals. You're resting, there is no pain. But on you trying to bear weight on the foot, the pain comes back. because the outgrowth is there, but it only gives you pain sensations when you happen to put weight on the foot as you pierce the plantar fascia. So some of the factors that can predispose you to having such a condition is: 1, having excessive weight in comparison to what you're supposed to carry. And this is according to your BMI, because you're going to have a much higher load on your calcaneus in comparison to the other one who doesn't load it much. So you'll have a higher chance of having that inflammation and outgrowth faster compared to the one who doesn't have a higher weight. 2 is having a flat foot. Flat foot means that your arches are not oriented well, so your line of weight bearing is disrupted, and the outgrowth can form at any side that feels that weight more. It's the same thing with the high arched foot or the pes cavus. Pes planus is the flat foot. Then the other one is walking barefooted. Walking barefooted because you'll have a thin padding between your calcaneus and the ground, so it will feel more pressure. Thirdly is putting on those shoes with hard surfaces or hard soles, because you are having a hard surface between your sole or between your calcaneus and the ground. Thirdly, or another one is to do with prolonged standing. Prolonged standing because you are having a much higher time loading this foot compared to the other one who gives it some interload. So these and very many other factors can predispose you to such a condition depending on an individual level. So in the management, we usually have different goals. So in the management, we have different goals. And goal number 1 is to make sure that our disease does not progress to severity. So we do this by 1, doing patient education. So our patient can proceed with their lifestyle, but with minimally invasive measures, so that this disease does not progress as far as standing, walking, and so on and so forth. That's where the other cushions, the heel pads, come in to increase on the volume at the sole of the foot. Then the other goal is to do away with the pain, and this pain is inflammatory. So that's why the anti-inflammatory drugs come in, which can be at first oral, and later we advance to steroids, which could be injectable. Then thirdly, we need to restore function, because some people come when they are limping, so they can't put their toes down. So we need to also involve the physiotherapist at one point. Then if the worst comes to the worst, that's when the surgical interventions come in to correct whatever has gone wrong or to excise that outgrowth. Thank you.